So I just want to start by actually giving a round of applause to everybody that is in this room. The work you do is incredibly important, and we couldn't be more honored to host you here today at the White House to have an afternoon-long conversation on mental health and the work that you all do on the national level, on the local level, from the federal government's perspective, and everything in between. So thank you so much. A few housekeeping items. We are live streamed today, and we have what we believe to be lots of people watching on our live stream. So if you could take out your cell phones now and put them on silent, not that we all don't want to hear your Taylor Swift ringtone, but we just want to make sure that our folks watching at home can hear all of the incredibly important conversations that we're going to be having here today. Today will be started off with an opening speaker that will be introduced in a moment. We'll have three incredible panels and closing remarks. For those of you that were not in the room when I announced it, bathrooms are right outside this door. You sort of weave your way back through, take a right, and then they're on the left and the right. So right, left, right. And in addition to that, I'm required to tell you that emergency exits are both in the front of the auditorium and in the back of the auditorium. I am now extremely pleased to introduce Vidur Sharma, who is in our Domestic Policy Council, who is going to introduce our opening speaker today. Vidur?
Thanks, Bess, and good afternoon to all. It's my privilege to introduce you to Vice Admiral Vivek Murthy, the 19th Surgeon General of the United States. America's doctor, as the Surgeon General is affectionately known by, has a tall order. He or she is responsible for communicating the best available scientific information to the public regarding ways to improve personal and public health. In this capacity, Dr. Murthy also oversees the operations of the U.S. Public Health Service Commission Corps, comprised of approximately 6,700 uniformed health officers who serve in nearly 800 locations around the world to promote, protect, and advance the health and safety of our nation and our world. Dr. Murthy has devoted himself to improving public health through the lens of service, clinical care, research, education, and entrepreneurship. The son of immigrants from India, Dr. Murthy discovered a love for the art of healing early in his childhood while spending time in his father's medical clinic in Miami, Florida. That passion only grew through his years of medical training and practice as a clinician. He also shared his passion with his students as an educator to hundreds of residents and medical students at Harvard Medical School. Dr. Murthy says that he regards caring for patients as the greatest privilege of his life. Today, through his remarks, I am sure you all will see his passion for others resonate through his words. At this point, I welcome America's doctor, Dr. Vivek Murthy, to take the stage. Thank you.
Thank you so much, Vidur, and so good to see everyone today. How's everyone doing? I'm glad you all made it through the long lines. I heard it was pretty hot out there. But thank you for persisting, for making it, and for helping to support us in talking about such an important issue. I also want to, for those of you who have not been to the White House before, just a big welcome to you. And for those of you who are joining us from the live stream, we are also so glad that you could make it and be with us today because we have a very exciting lineup in the panels that are to come. I particularly also just want to thank Cecilia Munoz, the director of our Domestic Policy Council for the White House, for her leadership in making these series happen. I want to thank Bess Evans as well. And I want to give a particular shout out and thanks to one of my colleagues and partners, Kana Enomoto, who is the acting director of SAMHSA. And many of you know Kana and her wonderful work on mental health and on substance use. She and I have been working together over the last year and a half to produce the first ever Surgeon General's report on substance use, addiction, and health. And this is particularly important and timely given what we're talking about today because of the great overlap between people who are living with mental illness and with substance use disorders, millions of people, in fact. So glad to have Kana here with us today as well. You know, as I was preparing for today, I was thinking about an experience I had nearly 25 years ago. I was sitting at the dining table next to my sister. We were working on some homework together, actually. And the phone rang. And I picked up the phone, and it was my uncle's roommate. My uncle had come to the United States just a few years before that. He was an architect back in India, and he was looking to build a new life for himself here in the United States, just as millions of immigrants have done over the years. And as part of that process, he was looking for jobs, and he had found a home for himself, which he shared with 2 other roommates. Now that day, he didn't come out of his room. So his roommate had called to ask us what she should do. And we knew he was hard of hearing, so we said, "Just knock a little bit louder. Maybe he didn't hear you." So she did, and she came back, and she said, "He's still not answering." So finally, we got worried, and we said, "Well, why don't you go ahead and call the police and have the door broken down? Let's make sure he's okay." So she did that, and then she came back after 2 long minutes that seemed like an eternity and said, "We found him, and unfortunately, he's taken his own life." I was in high school at the time. My sister was as well. We barely knew how to process this information, and I still remember the state of shock that we were in when she uttered those words. But in the days that followed, in the weeks and months which rolled on, we asked ourselves the same questions that so many families do who have loved ones who are living with mental illness. We asked ourselves, were they signs that we missed early on? If we had seen the signs, we asked ourselves, could we have gotten him help? And third, we asked ourselves, will society judge us because of what happened to our family? At the heart of these questions are 3 big challenges that we are facing with mental health, which are overcoming stigma, helping people understand how to identify someone with early signs of mental illness, and ensuring that mental health care is available and accessible to all who need it. And while we have not yet solved all of these challenges, I'm very happy to tell you today that we have made a lot of progress in the last few years, thanks to so many advocates and families, thanks to lawmakers and government leaders who came together to help us build policies and programs to improve the lives of those living with mental illness. The report that was released just today, Making Healthcare Better, details much of this progress as well as some of the work that we still have left to do. And that's at the heart of the discussions that we're going to be having today. We have 2 panels today that are going to be focused on mental health services, the first targeting coverage and access, and the second exploring how we can improve the delivery of mental health services. We have a third panel which is also going to delve into the nature and experiences of mental illness for patients, for families, and for caregivers. Now, the ACA has been a critical factor in helping us improve care for those living with mental illness. The law has helped us expand protections to millions of Americans who can no longer be denied coverage because of pre-existing mental health conditions, and for that matter, for any pre-existing condition. The law has also helped invest billions in expanding community health centers, which are a very important source of mental health care, especially for those living in underserved areas. And most notably, the ACA has brought millions under the umbrella of coverage so that they can access something that everyone in America should have access to, healthcare. Now, the reality, though, is that there are still millions of people who are uninsured in America, especially in states which have yet to expand Medicaid. And my hope is that that is a problem that we can fix as quickly as possible. But the ACA has not been the only factor. The 2008 parity law has helped to put mental health and substance use disorder treatment on the same footing as medical and surgical treatment, an important step toward reducing the barriers to getting mental health care. And there are other efforts that are underway as well. HHS is involved in driving pilots to use telemedicine to provide mental health services to people living in rural areas. And Project Aware, which was proposed by President Obama in the wake of the terrible Sandy Hook tragedy, is now raising awareness about mental health issues in schools. It's training teachers in mental health first aid, and it's also connecting young people and their families to help. These are just a few of the areas of progress which you'll find in the report, and many more will be discussed in the panels that we have later today. So we've come a long way, but as far as we have come, we know that there is a lot more work left to do. We know that we have to, for example, not only ensure that we have better programs and policies, but we also have to change how our country thinks about mental illness. We know that right now, only about half of people who are diagnosed with mental illness actually get treatment. And one of the big reasons for that is the continuing stigma that still surrounds a mental illness. Now, one person in my office recently told me, he said, if I twisted my ankle over the weekend and I had to go to physical therapy a few times a week, I'd have no problem telling all of you guys. But if I had a mental health crisis and I had to see a counselor 2 or 3 times a week, he said, there's no way I would tell people in the office. And that sadly reflects an ongoing stigma we have around mental illness. But we have to eradicate that. And changing perceptions of mental illness requires changing culture, something that's not easily done through policy alone. It requires us to tell our stories and also to encourage other people, nurses, doctors, teachers, faith leaders, to tell their stories as well. But there's one last thing I want to mention that we have to do if we want to improve mental health in America. And that's that we have to focus on improving emotional well-being in our country. Now, emotional well-being is not just the absence of mental illness. It's more than that. It's a resource within us that can help us reach ever closer to our full potential if it's cultivated. The good news is that there are programs that are already succeeding in cultivating emotional well-being. Many of you are familiar with the Becoming a Man program in Chicago, which is bringing at-risk young men together for mentorship, for social connection, and to talk about a range of issues, including conflict resolution. And in a randomized controlled clinical trial conducted over 1 year, the Becoming a Man program was able to reduce violent arrests by 44%, a remarkable difference in just 1 year. And in Visitation Valley Middle School in San Francisco, that school has taken a meditation-based emotional well-being program and has used that to drop suspensions by 45% in 1 year. They've used it to create significant improvements in anxiety and sleep scores from among the students. And they've also significantly improved grades and test scores. And these results have been replicated in other schools. So emotional well-being is critical for the well-being ultimately of our country, but it's also especially important that we recognize it in caregivers, particularly family members. Because in a time when far too many caregivers are burning out, we have to make it a priority to learn to strengthen ourselves so that we can help heal others. So in the end, as much as we will do through policies and programs, all of which are critically important, I believe that to truly solve the mental health challenges that America faces, we have to embrace a fundamental American value that has helped us overcome so many challenges in the past. A value that tells us that we are responsible for each other, that we are ultimately responsible for each other. My grandfather understood this nearly half a century ago when he lived in a small village in India. My grandfather was poor. He didn't have much of an education. He didn't have much in the way of money. And his wife died when my father was just 10 years old, leaving my grandfather to raise 6 children on his own. Now, times were very tight, and my dad would often tell me that dinner time often involved then boiling some grain or dal and diluting it and diluting it and diluting it until there was enough to fill every bowl of every child around the table. That's how tough times were. That's how poor they were. But despite that, my grandfather made it a point to take 1 month every year to travel to different villages to raise money to build a youth hostel so other students could study. Now, people would look at him and they would say, "You're so irresponsible. Your own family doesn't have enough food to eat. And what are you doing raising money for other people's kids? Shouldn't you take care of your kids first?" And he would listen to them quietly, and he would reply with one simple thing. He would say, "Those kids are our kids too. Those people are our people too." It may be that the most important resource that we need as a country to overcome the crisis that we face with mental health is, in fact, compassion. As strong as our policies might be, our nation cannot fully heal without compassion. And I realize this is not a bread and butter topic for a Surgeon General to bring up. But I will tell you that I learned during many long nights of caring for patients during some of the darkest moments in their lives that compassion is what allows us to stop judging and to start helping. It's what allows us to step beyond our own bias and offer support. And help and support are what so many families need right now as they struggle to support their loved ones with mental illness. And to all of you who are here today, especially those of you joining from afar, in particular to all of you who are living with mental illness and to your families, I want to offer my sincere appreciation and thanks to you because you are standing up, you are speaking out, and you are helping our country move forward on an extraordinarily important issue during a very, very difficult time. And it's people like you, it's efforts like yours that give me confidence and hope that we can build a stronger, more resilient, more compassionate America for each other and for future generations. Thank you so much, everyone.
I am the timekeeper, which makes me maybe the scariest person here in Washington, D.C. today, but we are just so thrilled to be closing out this incredible event with our distinguished closing speaker, and to introduce him today, Matt Steiner, who is the Associate Director in the Office of Public Engagement, will come to the stage.
Man, thank you very much, Bess, and I'll keep this really short. I have the honor and privilege of introducing my former boss, friend, and fellow veteran, Secretary of Veterans Affairs, Bob McDonald. Bob McDonald was nominated by the President to serve as the 8th Secretary of Veterans Affairs. It was confirmed unanimously by the Senate this summer of 2014. Prior to leading VA, Secretary McDonald was Chairman, President, and CEO of the Procter & Gamble Company. As a highly successful businessman, he's taken the skills he learned in corporate America to VA. Through the department's initiative, My VA, putting the customer first, the veteran, improving the employee experience so they can better serve veterans. But most importantly, Secretary McDonald, Bob, is a veteran himself, and he gets it. From the United States Army, having graduated from the United States Military Academy, West Point, top 2% of his class. So ladies and gentlemen, Secretary Bob McDonald.
Thank you, sir. Good to see you. Thank you. Well, as you may know, Matt's a Marine Corps veteran, and I'm an Army veteran, so that's the first time a Marine Corps veteran has said something nice about an Army veteran. Did we get that on film? Good. Bess, I need that on film. Matt, you're in deep trouble with the Marine Corps Veterans Society. It's great to be here, and on behalf of all of America's veterans, my deep thanks to everyone here who's made this second event in the Making Healthcare Better series possible. Let me acknowledge our Veteran Service Organization members and their leaders who help bring the challenges of veterans' mental health needs to national attention. I also want to acknowledge the diverse group of researchers and leaders gathered here to discuss quality care for Americans suffering from mental health conditions. All of the other stakeholders in the fight for better mental health care also I would like to recognize. Elevating the conversation on mental health care means finding solutions. It means getting to the tangible outcomes that are truly transformational for our nation's veterans and for all Americans. Mental health is a national problem that has to be solved collaboratively, and that's why we're here. At VA, we're privileged to have a truly exceptional mission that we take from President Lincoln's second inaugural address to care for those who have borne the battle and their families. We also have exceptional institutional values. They're noted in this acronym, in this button we wear: integrity, commitment, advocacy, respect, and excellence. All of them are known by the acronym of I CARE. And they're the foundation on which all of our efforts are built. Our mission at VA is noble, and I'm proud to be part of it. But it's not just my mission, nor is it just VA's mission. Taking care of America's veterans is a mission so important and so broad that no single agency can do it by itself. When we work together and collaborate to best serve veterans, we're all answering President Lincoln's charge to care for those who have borne the battle. The costs of war endure far greater and longer than the wars themselves. After more than 15 years at war, more and more service members are surviving combat. Many of them live with both the invisible and the visible injuries of war. We anticipate that the demands for VA health care will continue to grow as active duty personnel continue to return from service in the Middle East. Their mental health needs are no less important than their physical wounds. Both deserve the same high standards of excellent clinical care and treatment. To serve the growing number of veterans seeking mental health care, VA has deployed significant resources and increases in staff. And we're working closely with the Department of Defense, Department of Health and Human Services through the Interagency Task Force and Cross-Agency Priority Goal in service member and veterans' mental health. Through these efforts, we're implementing President Obama's 2012 executive order and 2014 executive actions to improve access to mental health services and quality of care for service members, veterans, and their families. We've also integrated mental health services into primary care in the new patient-aligned care team model, or what we call PAC teams. We've learned that providing mental health care within the primary care clinic minimizes barriers and reduces stigmas which sometimes discourage veterans from seeking needed care. This has increased the number of veterans whose mental health needs are recognized and treated early in the course of illness. In fact, the number of veterans receiving specialized mental health treatment from VA has risen each year, from over 900,000 in fiscal year 2006 to more than 1.6 million in fiscal year 2015. And you may be interested in knowing that VA leads also in telemental health. Last year, in fiscal year 2015, we had 667,000 telemental health completed appointments. Addressing mental health issues is not just about the number of people treated, though, and how quickly they're treated. It's also about ensuring that individuals facing mental health challenges and their families know that help is available and, importantly, that treatment is possible. In addition, VA has programs for veterans who, due to the symptoms related to mental health conditions, have interactions with the justice system. Given their high rates of mental health conditions and substance use disorders, VA places special emphasis on outreach to veterans who are homeless or at risk of being homeless. We owe it to them to save them from the worst possible outcomes and help them find productive alternatives to incarceration and life on the streets. We're proud to be working with over 350 veteran treatment courts and other veteran-focused efforts across the country. The number of those courts has grown dramatically over the past 8 years. In fact, I think Matt started one of the very first veteran treatment courts in Oklahoma when he was serving there. VA is working to fulfill our commitment to veterans by putting their needs, expectations, and interests first. That's why our My VA transformation strategy is all about modernizing the VA. 5 simple strategies. First, improve the veteran's experience. Second, improve the employee experience. It's no secret that the best places for customer care are also the best places to work. Third, improve internal support services. Some of our computer systems date to 1970s. Our financial management system is actually written in COBOL, which is a language I wrote at West Point in 1971. Our scheduling system until last month dated to 1985. It was like working with green screen MS-DOS. Number 4, establishing a culture of continuous improvement. We're teaching the organization Lean Six Sigma and trying to inculcate that in the culture. And last but certainly not least is expanding our strategic partnerships. That 5th strategy, expanding strategic partnerships, involves all of you. Best serving veterans and their families depends on networks of collaborative relationships, generating the greatest innovations. Strategic partnerships that drive important advances in healthcare and in research. You know, VA spends about $1.8 billion a year on research, leading to major breakthroughs in American medicine. Our research initiatives, outcomes, and honors are tremendous. Few know that VA researchers have received 3 Nobel Prizes and 7 Lasker Awards. VA researchers pioneered the electronic medical record, and they pioneered the barcode software that keeps patients and medicine and records all the same. They developed the implantable cardiac pacemaker. We proved that an aspirin a day helps reduce the risk of cardiac disease in heart patients. We conducted the first effective liver transplant. We created the nicotine patch. We demonstrated that patients with total paralysis can use their minds to control artificial or robotic arms. And we're pioneers in mental health research, discovering effective, evidence-based treatments, including state-of-the-art psychotherapies and biomedical treatments for the full range of mental health conditions, including post-traumatic stress. And one of the things that's a highlight yet to come is we've developed a predictive model for suicide. In fact, this predictive model has showed that if you take the 0.1% of individuals at the top of the model, they have an 80 times more likely risk of taking their own lives. This is a model we're currently working through, validating and using to try to help avert veterans taking their own lives. Almost everything we do on behalf of veterans is related to other things we do. None of VA's initiatives or programs operates in a vacuum. Mental health issues, including PTSD and depression, are often a contributing factor to a variety of other problems some veterans face. These issues, perhaps in combination with other physical injuries, including TBI, substance abuse, and relationship issues, sometimes lead to a downward spiral that can lead to things like homelessness, incarceration, and in some cases, suicide. Anybody read the comic strip Doonesbury? Do you remember the character BD? BD suffered from both physical wounds and mental health issues. The situation Gary Trudeau portrayed could have had a very different ending. But in Trudeau's column, BD got the help he needed. Early intervention and friends helped him at a vet center. BD's problems, as in the case of many veterans, were clearly evident to those around him, but importantly, not to BD himself. Gary Trudeau did a great service, taking a serious and all too real situation for many veterans and making it understandable for a much larger audience. That's education. Now, I'm not a doctor nor a clinician, but I believe early diagnosis and treatment of mental health can produce positive results for many veterans. As with homelessness, our requirement for resources is much, much greater once veterans enter the downward spiral I described. The rate of return on early intervention is astounding. Early intervention, diagnosis, and treatment can prevent greater tragedy and perhaps save a life. What do any of us do that's more important than saving the life of a loved one or of a veteran? I count myself blessed to be working full-time for veterans. We've made a lot of progress, but I'll be the first to tell you we still have a lot of work to do. If we're going to best serve veterans who have put so much on the line for all of us, then we must work together to see that they have the services and the health care that they've earned and that they deserve. The goal of today's dialogue and the Making Healthcare series better, Making Healthcare Better series is about achieving transformational outcomes for veterans and for all Americans. Together, I honestly believe we can make a difference, but we have to do it together. On behalf of the entire VA, I'd like to thank all of you for everything you're doing to better serve America's mental health care needs. May God bless our efforts, and may God bless the veterans, and may God bless the United States of America. Thank you very much.
What an absolute honor to have Secretary McDonald here. And thank you all finally for all of your participation today. Before we end, I just want to give one final thanks. It's actually 5 final thanks, but there are 5 organizations that really chipped in to make this event happen today. This incredible dialogue, the incredible exchange of ideas. Without them, we would have not been able to do this event today. So I want to say a special thanks to the National Council on Behavioral Health, the Depression and Bipolar Support Alliance, the National Alliance on Mental Illness, Mental Health America, and the American Foundation on Suicide Prevention. Thanks to those incredible organizations and the work they do every day. And finally, I want to thank all of you for coming this afternoon in a very cold room, but for a very warm and thoughtful dialogue, and we look forward to continuing the dialogue. Thank you so much.